There are no signs telling you how to get to Lologi Hospital. It's just there, off a dirt road, the middle of nowhere, as it were, in northern Uganda. But somehow everyone knows where it is, and they come by the hundreds, rarely by car, often on foot, mostly on bicycles. They will travel like this for hours. The boy on the back of that bike has malaria. And when they arrive, they will wait for hours. I'm not happy sitting here, she says. I came at 8 this morning. It's now 1. I'm worried I'm now going to have to wait until after the lunch break. Inside, Richard Nyeko, one of the medical officers, is trying to keep up. The other medical officer in the only other examination room is just as busy. It is hot outside, 80 in the shade, but all they can do is wait. The thing is, they don't have much choice. The nearest big town is miles away. Another 6 hours on a bike. Walking? Unthinkable for a sick person to even consider. So they wait. Medical care in Uganda is free, which is important because many of the people who come to this hospital don't even have enough money to buy food, let alone pay for medical care. Among Sekon is here with her 2 children. If it were a service based on paying, I could not, she says. These children could even die. On the hospital ward, the 3rd Ugandan health officer has her hands full with patients who have already been admitted.
This child here, we have admitted him because of severe malaria, came with a history of convulsion and loss of consciousness. So we have given him treatment. Now he's conscious, has started eating today.
Over in maternity, we do a quick poll to see how far these pregnant women walk to come for their antenatal class. An hour? Just a few raise their hands. 3 hours or more. Just about everyone. And they still have to walk back home again. You've probably noticed that we haven't used the term doctor yet, because there are no Ugandan doctors at this hospital. Jane and Richard, as we've told you, are health officers, which means they've had basic medical training, but they're not doctors, even if they're doing the work a doctor would do. And by Western standards, their salary is incredibly low.
About $100 a month.
Something like that. Yeah.
Now you can understand why there are no Ugandan doctors around. And there is no doubt about the need.
So here is a baby of 3 weeks. We are treating the baby for respiratory tract infection, at the same time for congenital syphilis.
It may look like a pretty grim situation, but as far as hospitals go in rural Uganda, Lologi is one of the better ones because it's getting some outside help. MSF, Doctors Without Borders, is here. They arrived 3 years ago when this entire area was under siege by rebels, providing a couple of doctors, sometimes nurses, and recently a midwife. Samantha Perkins is on call 24/7. This call is serious. A newborn, minutes old, struggling to breathe.
You can see from baby's colour that baby is working very hard on the breathing, so the oxygen supply around baby's circulation is very, very low. So really, we need, ideally we should have oxygen.
There is no oxygen at Lologi, so the newborn will be taken to another hospital in this 4-wheel drive. The trip will last 90 minutes. The baby will get the oxygen it needs, and we hear later that it survives. The MSF staff here say they are overwhelmed by the dedication of the Ugandan health staff, people who work long hours for little money, sometimes even volunteering, working for free. It's the end of the day and Richard is still seeing patients. He goes outside to check how many are left. The exhaustion, plain to see.
Yeah, I feel sad. Like I've been sympathizing with some of them who came from a distance.
Rather than turn them away, he admits them to one of the wards. He'll see them in the morning. And this is the situation despite all the outside help. A year from now, things will be different. That rebel group is gone, so MSF says it will be leaving, moving on to another emergency. Will the people in this district have a hospital a year down the road? Probably. The Ministry of Health is determined to keep things going, but the people will still have to travel enormous distances to get here. And for sure, the waiting isn't going to get any easier. For World Focus, I'm Martin Seemungal in northern Uganda.